The fight against coronavirus in Kano State is becoming worse by the day as the state battles with the communal transmission stage of the pandemic. But authorities are also battling with residents who believe the disease is a hoax. The situation is becoming grim in the northern Nigeria's commercial city, where unusual deaths were recently recorded. TVC News correspondent Ibrahim Isah takes a tour of one of the isolation centers in Kano, where severe patients are accommodated.
The Asian city of Kano is known for its commercial prowess and trade. But with the global pandemic gaining traction across all the 44 local government areas, life itself has taken a whole new dimension. Social distancing, a whole new phenomenon may say to catch on for one reason. The sense of community and togetherness rings loud, and Jade's effort aimed at keeping everybody safe. Today, Kano State is the epicenter of this global pandemic, which is yet to peak, let alone plateau in Nigeria. Why is this? So many have asked, and the answer is simple. There has been a near daily influx of people from states with confirmed cases for a number of reasons. The population, connectivity, and easy access from neighboring states has come with its consequences. The situation is severe as the state is battling with community transmission.
This disease has transmitted into community transmission. We used to look at it as people who came from abroad or people who came from Lagos or the Federal Capital Territory, where the first cases were recorded. But as of now, that is history. This disease is with us, in homes, in neighborhoods.
Asymptomatic carriers of the virus have continued to infect unsuspecting persons, and this has in turn seen a spike in the recent number of confirmed cases. Officially, Kano has reported more than 1,000 cases and more than 40 deaths attributed to the virus, but the reality is the state has witnessed a major outbreak. Government has battled to keep the numbers in check, and only recently it seems the figures are reducing, but many ask if testing has increased. To understand the mindset of people, we visited Dawaki, one of the isolation centers that had accommodated patients with severe symptoms. We were welcomed and screened by a team of security personnel at the main gate of the facility and then granted access. I was received by the medical doctor in charge of the treatment center, Abdullahi Anifawoshe, who ushered me into his office for a brief off-camera on the protocols of filming inside the wards.
This is Kano Isolation Center. Behind me is the ward where COVID-19 patients with critical symptoms are kept. In a short while, we'll go in to bring you what transpires inside.
Inside the building, 72 beds have been provided. 27 have been reserved for those who need intensive care. I and my cameraman became jittery, knowing fully well the journey we embarked upon. The fear became even worse when our camera was sealed. We moved from the office section to the building. Upon arrival, we were guided on how to wear our personal protective equipment by the nurses in the building. The intensive care unit of the isolation center was
and weakness. I can't breathe normally. Well, coronavirus exists. It's a truth, not a lie.
This situation started, like my wife was saying, when we had some cough and difficulty in breathing and high temperature. We started traditional medicine, like what is called surachi, breathing, and then herbal treatment. But then it escalated that we could not cope, and we had tests for the coronavirus at Kano, who were confirmed positive. So we were taken to this place, and Alhamdulillah, since we came, we have been having a very, very good treatment and services.
In another unit lies another lone patient. His story is quite different from the others. His unit mates have lost their lives, where others have been discharged.
Well, having gone through this, I think I'm no better evidence to anybody that coronavirus is real. I've gone through it, and I've seen that this disease can kill people. Luckily, I've survived. In fact, the same room we were in, one of the patients died. So I am informing people that coronavirus is real and people should take precaution. This social distancing is very important. Wearing masks and making sure that anytime you get close to people, you use sanitizer to wash your hands.
More than 40 health workers have tested positive for the coronavirus in Kano State. Despite this, Dr. Abdullahi Anifawoshe says providing care for the infected remains a job they cannot resist.
And you can see now that we are already treating them. We have been treating many people, and you can see some of them still on the ward. And if you see them some months or some weeks back, you will not believe they'll be like this. But we thank Allah, they are like this, they are doing well, and hopefully we're going to discharge them. So we are prepared to take care of patients with COVID-19 as far as this center is concerned.
To date, 150 cases have been treated here, and many discharged. But in this Asian city, many seem to believe that COVID-19 is a hoax. This probably accounts for the high numbers and the frustration on the part of the government as it puts in place measures to contain the pandemic, which still has no vaccine. At this isolation center, frontline medical personnel give it their all.
The number of medical professionals or personnel who have been infected, I think I have about 30 to 40 in numbers who have been brought to the facility and treated one way or the other, who are under our care. But from this facility, we have few personnel, about 4, who have also been infected, and thank God all of them have been treated and they are now stable.
Many have witnessed hard times due to COVID-19. There are survivors. Some of them were being evicted from the isolation center after testing negative twice for the virus. This woman is one of them.
I strongly believe coronavirus exists. I have been infected and I am now negative. I started my test at Kano Teaching Hospital and it turned out positive. I was brought into this facility unconscious. I spent a week under the intensive care.